No, you don't have to be an athlete to come and see me. I see all types of patients, anywhere from an older adult who's looking to get back into their walking routine or physical activity routine, or the younger patient who's maybe a high school athlete or a college athlete, or even a middle school athlete and just trying to get back to performance and sport. It depends. If you have a pre-existing injury or condition, you would go through Dr. Clearfield first. He would evaluate you and then refer you to me. Or if you are a healthy patient who does not have any sort of injury or condition that needs to be seen by a doctor for, then you can see me for a functional movement exercise program or sport performance if you are a competitive athlete. So a couple of the key differences between an athletic trainer and a physical therapist is that a physical therapist is going to work with a broader range of illnesses and conditions, patients such as cardiac patients or stroke patients or patients needing vestibular therapy, things like that. I only work with patients who have had musculoskeletal injuries. Athletic trainers are also trained to do injury prevention and sport performance as well. Whereas a physical therapist, they're always working with a patient who needs some type of recovery and return back to normal life. There is a time and a place where physical therapists and athletic trainers can work together. Physical therapists work great with those first couple of months, like post-procedure, post-acute injury. But then when a patient needs to return back to performance, an athletic trainer will step in and help return the athlete back to their sport. Yes, you're gonna see athletic trainers on the sideline of sporting events, running out onto the field to help with hydration, providing emergency care for athletes who need it, and helping athletes who've gone down with an injury on the field or court. The profession should be specifically distinguished as athletic training and athletic trainers. That gets really confusing to refer to them as trainers because trainers also refers to a personal trainer, and there's a really big difference between personal training and athletic training. So initially I became an athletic trainer because I really enjoyed working on the sideline of sporting events, especially football. That was one of my favorite sports to work. As I got further into the profession, I realized how much I enjoyed working with patients one-on-one, taking them from their injured, dysfunctional state back to not just their normal healthy self, but to their best self, returning them to their sport and their optimal performance.